How do genetic inheritance concepts affect muscular dystrophy families? Imagine a family gathering where a genetic story is quietly unfolding across generations. Muscular dystrophy is a group of inherited conditions that cause muscles to weaken and waste away over time. The way these conditions are passed down through families depends on specific inheritance patterns, which can influence how the disease appears and how families manage it. Understanding these patterns is key to making informed decisions and providing support. Most commonly, muscular dystrophy like Duchenne and Becker types follow an X-linked recessive inheritance pattern. This means the faulty gene is on the X chromosome. Since males have only one X chromosome, if they inherit the mutated gene, they will usually develop the full disease. Females have two X chromosomes, so if one carries the mutation, they are often carriers. These women might not show symptoms or have very mild signs but can pass the mutation to their children. A carrier mother has a 50% chance of passing the mutated gene to each son, who will then likely have the disease, and a 50% chance to pass it to each daughter, who then becomes a carrier. Other forms, like limb-girdle muscular dystrophies, follow an autosomal recessive pattern. Here, a child needs to inherit two copies of the mutated gene, one from each parent, to be affected. Carriers with only one mutated gene usually do not show symptoms but can pass the gene to their children. If both parents are carriers, each child has a 25% chance of inheriting the disease, a 50% chance of being a carrier, and a 25% chance of inheriting two normal genes. Some muscular dystrophies, such as facioscapulohumeral or myotonic dystrophy, follow an autosomal dominant pattern. In this case, only one copy of the mutated gene is enough to cause the condition. If one parent has the disease, each child has a 50% chance of inheriting it. This pattern means the condition can appear in every generation, often affecting multiple family members. Knowing the inheritance pattern helps families understand their risk of passing muscular dystrophy to future children. Genetic counseling is a valuable tool that can clarify these risks, guide family planning, and help families prepare for possible health needs. Advances in genetic testing now allow families to identify carriers and understand their chances of passing on the condition. This information can be empowering, helping families make choices about having children and managing health proactively. Understanding the genetic basis of muscular dystrophy also opens doors to better medical care. Families can access tailored support services such as physical therapy, surgical options for complications like scoliosis, and ongoing medical monitoring. It's important to remember that each family's experience is unique, and individual genetic makeup can influence how the disease manifests and progresses. In summary, the way muscular dystrophy is inherited shapes how it impacts families. By learning about inheritance patterns, families can better understand their risks, seek appropriate genetic testing, and make informed decisions. Always consult healthcare professionals for personalized advice and support, as genetics is a complex and vital part of managing muscular dystrophy.